Hey, General Hoyer.
Yes.
Do you mind scooting to your right just a hair, because the interpreter box will be in the upper? Yeah, there you go. That'll work. Perfect. And you can see the flags as well.
Okay, you got me okay?
I hear you loud and clear. Thank you, sir.
All right, thank you.
Hello, everyone. We're going to do our briefing now. I would tell everyone the sun's shining and it's pretty outside. Try to go out and maybe get a little, air. That would be really good. I've got 2 or 3 things to go over with you. I think we'll be able to move along much quicker today. The first thing that I'd like to report is we had an Elkins police officer, that was Senior Patrolman Daniel Sayer, 25 years old, that was shot last night basically in an arrest that was going on. Had nothing whatsoever to do with this, the coronavirus in any way, but he's in good condition. He's at Ruby Memorial, and we just want our prayers to go out to him and his family, and always remember the great work that all of our police officers are doing all the way across our state. We have now 76 cases in our state, and that are confirmed. You notice that it's continuing to grow, and it's and our health officials will report on the curve that it's growing at. One thing I've got to address is just this, because I don't know how to say this other than this just makes me flat mad. That's all there is to it. I have been reported to on 2 different days by very senior people that we had a death. 2 different places, 2 different counties, and in both situations, just to tell it like it is, we weren't right. And it's tough enough on me from the standpoint that we're trying every way, let me say I'm trying every way within me to see that we protect everyone, and every single life is a tragedy if we lose one. Now, we all know the odds are really against us, being a high-risk state that we are, that is almost inevitable that that's going to happen. But it's still beyond tragic. And so I am now initiating additional safeguards to make sure, surely to the Lord above, we can get it right that someone has either passed on or not. And there's plenty of chaos out there, but this is inexcusable in my book. I guess I've got 2 other things to report, just really one other thing, I guess, to report, and that is we are receiving surgical masks. We've gotten 50,000 in now, on our 100,000 previous order and everything. There's stuff on the way to us. We're pushing it in every direction all across the globe. We're pushing down from the top with me, with the president and all that stuff. Every state, every governor, every city, everybody's screaming, for any kind of, supplies that are out there. And so we're in the food chain. We're going to make it happen. It's better. It's getting better. And so the long and the short of that is just simply this. We're getting supplies in. We'll continue to push in every way, shape, form, or fashion, and we're going to get the supplies in. So that's really all I've got today.
Thank you, Governor. We're going to turn it over and take some comments from a few of our panel members. Up first, Secretary of State Mac Warner.
The famous World War II leader, General George Patton, who, by the way, had some deep roots here in West Virginia, once said that a good plan violently executed now is better than a perfect plan next week. And that's what we've got with the election that's coming up. We've got a good plan, and we're vigorously executing that plan. And here's what that plan is. The basis of our democratic form of government is a voter casting a ballot. Given the coronavirus situation, things may be cleared up and they may not. But if you have concerns about the coronavirus, every voter in this state is eligible to vote an absentee ballot. And to be fair, we're going to send out applications, not ballots, but applications to every one of those 1.2 million registered voters. That will occur the week of April the 6th, so about 10 days from now. Expect in your mailbox an application. It's a very simple application. It's going to look something like this, and it's just a real quick check of one block. Fill out your key information. That one block says the COVID 19, medical reason. That's giving you the reason. That's staying within state law, that everybody has to request a ballot, and that's what that process is for. Send it back in. Your county clerk will then send you the ballot. You vote that ballot and send it back in, and the election is behind you. You never have to show up at a poll if you don't want to. There will be early voting from April 29th to May 9th, and the election day is May 12th, Tuesday, May 12th. You can still go vote in person if you want to. And in that regards, it takes 9,000 people to run an election here in West Virginia, poll workers. We all know that some of our most loyal poll workers are those senior citizens. And so I would ask anybody that's able to work at the polls, we've got a campaign going on, elective service, and that is to volunteer to work at the polls if you are able to. We also may have, because of the increase in absentee ballots, a need for auxiliary workers at the courthouses, but the county clerks are in the best position to determine that. All of this information is available at the West Virginia Secretary of State's website, and for elections material, it's govotewv.com. govotewv.com, and you can get all the elections-related information there. The trusted sources are that website and your county clerk's website. Don't trust social media because they can't stay abreast of the fast-changing situations that occur with this coronavirus situation. With that, I'm here to answer any questions, and thank you for this opportunity to explain the upcoming election to our voters.
Thank you, Secretary Warner. Up next, Secretary Jeff Sandy with West Virginia DMAPS.
Yes, at the governor's direction, DMAPS obtained 100,000 N95 masks. We received our first shipment in on Monday at approximately 3 p.m. By 6:30 p.m. on Monday, we had our 55 counties either receiving those by overnight mail or coming personally to the Capitol to pick those masks up. Yesterday, we received our next shipment, and as of a few minutes ago, the first 20,000 to our first responders have been sent out, picked up, or they're on their way. It's important to note that these masks for the first responders are the city police officers, the county police officers, the paid fire department members, the volunteer fire departments, and the emergency managers in those counties. So that totaled 20. The governor also got 10,000 masks for our correction officers. And in addition, late last night and this morning, we received an additional 22,000, which has been taken to the National Guard warehouse for the DHHR. The next thing I'd like to address is our correction officers. Our corrections officers, in my opinion, and the governor has stated this, are some of the bravest people that I have ever met. And they are in our facilities, they're working hard. And as of the 7 a.m. report this morning, no employee, no inmate has the COVID-19 virus. Again, the reports are 7 a.m. and 3 p.m. and keep those people in your prayers. The next is the West Virginia State Police, Capitol Police, Fusion Center, and Fire Marshals. We ought to be extremely proud of them from delivering food to rural parts of West Virginia with the Department of Education and other charitable organizations. The people are working an average of 16 hours a day, and we got to give credit to our State Fusion Center because they have stopped countless events of fraud. So in ending, it's a team effort, and Governor, we appreciate your leadership during this difficult time.
Thank you, Secretary Sandy. Up next, Dr. Clay Marsh, our coronavirus czar.
It's good to be with everyone, and I'll keep my remarks really short as well. So overnight, we have seen no real increased rate of positivity for the total number of tests that we have done, which is a good sign and means that we, as a state, are doing, to me, the right things at the personal level to try to protect ourselves, our neighborhood, our community, and our healthcare workers. And I think it's really important to double down and not to be complacent, which is staying at home as much as you can, And if you go out for essential supplies. And if you're going to go outside, go out and be separated from everybody else, because even clustering together, if people are outside together, can lead to exchange of the virus. Wash your hands very frequently. Don't touch your hands to your face. The other thing we're doing and working with General Hoyer and his team is trying to create a pathway, not only that we can identify more personal protective equipment for our healthcare workers and for our first responders and essential personnel, but also test certain types of different material that may be able to be used so that the ingenious people in the state and the assets in the state can start to produce the personal protective equipment. And I will let him tell us how that's going. So those are my comments.
Thank you, Dr. Marsh. Up next, General Hoyer.
Good afternoon. The National Guard has 250 personnel on duty supporting this effort. At the end of each day, in supplement to the governor's press conference, the National Guard will publish specific activities that we are conducting. As Dr. Marsh said, we're working with higher education system, community education, and others to look at two capabilities. One is to produce masks, and the other is to decontaminate existing masks. We will have more information available on those the first of the week. And the last thing I would say is just, again, as the governor and Dr. Marsh have pointed out, we have to focus down as citizens on this over the next several days. We have a unique window of opportunity here, and if we follow the guidelines, as Dr. Marsh said, we believe we can continue to flatten the curve in the state of West Virginia. Thank you.
Thank you, General. And last, Secretary Bill Crouch with the DHHR to give his report.
Yes, thank you. My comments will also be brief. Under normal circumstances, many cases of abuse and neglect are reported by teachers and child care providers and others. We are in an unusual situation right here where everyone is staying home. If you suspect any case of abuse or neglect for a child or vulnerable adult, please call our centralized hotline at 1-800-352-6513. That's 1-800-352-6513. The only other thing I want to mention is that WIC benefits are now available through telephone contact. So you may call the WIC office and do not have to go to the WIC office to obtain those benefits. So again, women, infants, and children nutritional program through WIC will now accept telephone calls for those benefits. Thank you.
Thank you, Secretary Crouch. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. To media members, when we call on you, please remember to unmute the microphone on your end before asking your question. And today, some members will be asking their questions through video chat. The first questioner today will be Jackie Swigert with WVVA. Jackie, please unmute your microphone. Okay, we'll attempt to pick her up in a minute. Up next, let's try Kenny Bass with WCHS.
and get outside to avoid cabin fever.
Kenny, please repeat your question.
Yeah. Are we okay, guys?
We are okay. Please repeat your question.
Okay. Charleston Mayor Amy Goodwin has opened the Kanawha Boulevard tomorrow and Sunday to allow people to congregate outside. Unlike going to a lake or river or trail by yourself or with someone, this has the possibility of several people congregating in one place. Does that worry you in any way, Dr. Marsh?
Kenny, thanks for your question. Absolutely. I think that given the fact that we have made, I think, a lot of progress in social distancing and staying at home, I would be very worried about the potential for congregation. We know with this virus that one of the way it spreads is through droplet production. And we think about coughing and sneezing as part of the droplet. But as people talk, you can start to create some droplet connection. And with a clustering of people like that, I think in this particular situation, that is not the best idea.
I'd add something to that too is, I don't know why that we have to continue to try to short hop one another and everything, make the next political move. It is silly, in all honesty, for a lot of people to congregate together, even though to go out and do exercise, which we would welcome you to do exercise, but it is absolutely silly. And there's not one of our healthcare people that believe that that is prudent to do. Because really and truly, all we're going to do, if several of us congregate together, we're going to see friends, and who knows, you may give somebody a hug. You know, you're going to go, the bathrooms are open, there are going to be lines with the bathrooms, whatever the situation may be, it is just not the thing to do. And you heard our czar, our coronavirus czar, just say just that. It's the wrong thing to do. Now, we're going to try to do anything and everything we can to prevent that from happening, but it's just not right.
Okay, thank you, Kenny. Let's go back to Jackie with WVVA.
Hey guys, can you hear me?
Yes, we can.
Awesome. Okay, this question is for Secretary Crouch. The DHR website seems to be behind actual numbers. For example, we had a confirmed case in Greenbrier County yesterday, but that's still not reflected. How and when is the website updated?
The official count is updated every evening as we get the final count from the counties that come in, and as our own laboratory completes their results. Those are official because they're verified numbers. I've talked about trying to provide an unofficial report of that, but you reporters can look at every website out there and report on that. It's never official until we get that data and we get that information and we verify that information. So just as in other reporting that the governor spoke about, we need to be accurate and we need to be careful about that. So I've talked about trying to develop another system for you, but I'm not sure that's going to be workable. We have one system in the state that we utilize to confirm and verify cases and verify positive cases. That's a process that takes time. So you're welcome to look around the state and see what else you can find on social media, but that may or may not be accurate.
Okay, thank you, Jackie. Up next, let's go to Brad McElhenney with West Virginia Metro News.
Oh, hello. After we spoke yesterday, there was a national report about a system that the president seems to be advocating to rank counties based on data, low risk, medium risk, and high risk. I understand he must have talked about that in the teleconference with governors yesterday, and I wonder about your reaction given West Virginia's vulnerable population that we're all aware of.
Okay, Brad, thank you for the question. There was not a lot of discussion in regard, in the teleconference yesterday in regard to that. There was some discussion in regard to trying to get our nation back to work and trying to get the engine restarted, because if in fact we were to slip further and further and further into a gigantic deep depression, then you've got all kinds of issues and everything. Now, however, West Virginia is a very high-risk state. There is no mention whatsoever in the teleconference about anything to do with West Virginia. There's been no conversations with me and anyone at the White House and or the president in regard to anything to do with reopening back up West Virginia. There was mention yesterday about the fact that in the grain belt of the Midwest, you know, that may be an area where it would be prudent to maybe move forward to reopening and restarting the engine, as well as some of the western states. But there has absolutely not been any mention whatsoever of West Virginia. And to be perfectly honest, it probably would not. In fact, it would not be the right move to take at this point in time.
Okay, thank you. Up next, Dave Mistich with West Virginia Public Broadcasting.
Can you all hear me?
Yes, we can.
Okay. Governor, this might be for the Secretary Crouch. Earlier today, it was reported, you know, this death by DHHR, and then it was Sundale said that death did not occur. I think people are really worried, for obvious reasons, about the flow of information. I'm curious what protocol is in place for confirming cases as well as deaths moving forward.
Yes, thank you. We are looking at changing those protocols. We get reports from local health departments, health officers. We get reports from others. We try to verify those reports. In this case, there was a misidentification, and at the local level, the nursing home that first reported that issued a press release apologizing for that confusion, and they took responsibility for that. However, in the future, as the governor said, we can't tolerate those kinds of mistakes. So we're going to have a second confirmation, probably directly from the hospital. That will delay things, and I know reporters want to learn things quickly, but we're going to make sure that those kinds of things are confirmed before we report them.
Okay, thank you. Up next, we'll go to Anthony Izaguirre with the AP.
Hey, can you tell us if the state has made any headway in expanding testing to more people?
Yes, testing actually does continue to expand. We've got there's over 150 sites that have been doing some form of testing. We've now had about over 2,000 individuals who've been tested and received their results. We know there are more that have been tested and are awaiting their results. I think it's important, and we just had this conversation, that for managing the outbreak, what's actually most important, more than the speed of the data, is the accuracy of the data and the completeness of that data. And that's why you start those local investigations immediately. And then as that information comes in, you have more accurate and more actionable data that can follow. So I think you will start to see some more analysis and mapping of that data on the website moving forward.
Okay, thank you. Up next, let's go to Amanda Barron with WSAZ.
Hi there. I wanted to ask, I came in contact with a woman who is a senior citizen. She is in a high-risk category as far as her health is concerned, and she works 2 jobs. And I wondered what kind of and one of those jobs would be an essential job. However, what kind of protections, or is there anywhere seniors can call who are in that situation? It's no secret that many of our seniors work 2 jobs. What can they do? Who can they call? Who is their advocate in this situation other than themselves? And they're relying on their income.
Amanda, I can share some information here on this one. We actually are developing and finalizing to get out to folks today, because we had this question several times, in terms of some essential worker guidance or community guidance. So if you are needing to be out in the community and doing a function that you're needing to, say some of their folks have to go into homes, or you've got public service utility workers that are needing to enter homes. So there's guidance that's coming out there around, asking a question or two of the household before you go into the household, and how to handle those things. What kind of protective equipment might be helpful or important. So I think you'll see that guidance on the website, and I think people could use that every day as opposed to just the essential service workers.
Okay, thank you, Amanda. Up next, Stephen Allen Adams with Ogden.
Yes, Steve Adams of Ogden Newspapers here. Somebody had asked me about this yesterday, and I didn't. I've been saving it for today, but obviously we're talking. I think it was talked about yesterday about having people self-quarantine that come to West Virginia from another state, particularly a state where the coronavirus cases were more positive. But of course, West Virginia is very much a border state with people from Ohio, Kentucky, Pennsylvania, Maryland, Virginia, all coming to work in West Virginia. Some of them obviously would be working essential jobs. So the question was asked whether people coming from just across the border, whether there's any additional precautions that they need to take, whether it would be prohibited for them to come work in West Virginia. They just want some more clarification on that. Thank you.
Well, here's the thing, Stephen, I just try to talk, plain talk and truth. We understand that there's people that are looking at West Virginia as a place to go to get away from a real big time issue where they're at. And that really concerns us. And that's one of the things that drove us towards the stay-home order. Now, it is absolutely essential that those people, especially those people coming from New York, that they quarantine themselves for 14 days. We need the assistance of people that are residents of West Virginia to report a violation of that. And as we see violations of that, we're going to aggressively try to address it. Now, I don't know of exactly what we can enforce, but we've got to have the knowledge out there to where people will understand the quarantining of themselves is very important if they come to West Virginia. And as we go further, what has been already pointed out, there has been no state that's lined up tanks at the border and said you can't come in here. And we're making real progress by doing what we're doing, but that is an absolute concern.
Governor? So I also just want to make a quick comment. So I think that the governor is, of course, correct in his wanting to protect the state of West Virginia from people coming in to introduce the virus in the state. But I think the other important point to make sure that we are communicating is because this virus is a pandemic, we have to believe the virus could be anywhere. It could be carried in by somebody from New York, but it could also be carried by somebody in your neighborhood. So I think that it's really important that we use our own personal power to protect ourselves. And that's the instruction we've been given. 6 feet distance, wash your hands if you touch anything, don't put your hands to your face, stay in your house as much as you can with that family that's close to you or the people that you live with all the time. That's the way we start to break this spread and the speed of the spread, as well as trying to restrict people who might be coming from high indigenous areas.
Okay, thank you. Up next, Charles Young with WV News.
Hi, I know Secretary Sandy gave us an update on what is going on, in our jails and prisons. Yesterday, the West Virginia ACLU and other organizations called on the governor to issue an executive order reducing the prison population. Has any serious consideration been given to that?
We have had meetings with the West Virginia Supreme Court. In fact, at 10 a.m. this morning, we continued those discussions with them. With the powers that the commissioner has under the West Virginia Code, we have released 70 non-violent offenders who were close to the end of their prison term.
Okay, thank you. Up next, we'll go to Nathan Lane with Reuters.
Hello. Not sure exactly who to address this to, but wanted to ask about contact tracing. Hoping you could sort of explain or characterize the importance of contact tracing in your attempt to limit the spread in West Virginia, and then sort of confirm whether the idea is to do contact tracing for all of the infected cases that you have, and what kind of resources that you're putting towards this. I believe the National Guard is involved in this effort. Thank you.
Great questions, and there's lots of activity in that arena. So there's really a couple of pronged approaches. One is to do immediate case investigation, contact tracing, and outbreak management very aggressively with with individual identified cases. So there are protocols in place and how we do that. That typically is started at the local level, but we actually have regional epidemiologists that are around the state. We've bolstered that and have trained National Guards partners with those individuals. So there's a team of additional 4 folks there that can support the counties in that. We have been doing all the training that they need to get up to speed, that they can train others, so we can kind of tier that out. And then we are looking at down the road what is the additional manpower that might be needed as cases increase. So prong one approach is that case contact investigation and that outbreak management, really critical. But the other thing is you don't do that alone. And because while testing is important, and but we know that as a nation we are not going to be testing or identifying every individual with this disease. And many of these disease cases are minimally symptomatic. So it's incredibly important at the same time as you're doing that rapid contact investigation and tracing and outbreak management that we do the preventive measures in partnership with that everywhere. So if people are relying on the testing data and the maps of what county it's in to think that identifies risk, I think we are in danger. So I really worry that people and the media over-rely on that testing data and maps to kind of geolocate risk. As Dr. Marsh said, we need to be thinking about this being everywhere. And so if we had a vaccine, we'd all be taking the vaccine. We do have a vaccine here. It is essentially those prevention measures that we've talked about. And that vaccine is that physical distancing. That vaccine is that guidance of stay home if you are sick. So if you have illness, pretend as if that is consistent with COVID-19. Pretend it's COVID-19. Stay home till at least 3 days after fever has resolved off of any kind of medications like Tylenol or ibuprofen, that kind of thing. But at least 7 days total. So you need to stay home that long and take all those measures that you would otherwise do to help prevent spread of disease within your household. So that's, again, that vaccine that we have is that physical distancing and that stay home if you are sick. That's the things that we can do the most with to really block the virus from spreading further. And we do that everywhere. We should be doing that everywhere, not just simply based on where you see case test results.
Okay, Governor, back to you.
Okay, well, I don't have much. I would only recommend to people to just keep the faith. The things that we're doing are working. We can't absolutely be for sure anytime, but absolutely stay at home as much as you possibly can. Try to get your exercise in a very small group, or by yourself, and enjoy the sunshine and maybe walking a dog if you choose to do so. And the other things, there was Amanda Barron mentioned a lady that had some health issues and everything. She was a senior trying to work 2 jobs and everything, and one of them was an essential job, and she's just trying to put bread on the table and keep things moving in the right direction. And I would say to her 2 things. I would say our nation and our state has got your back, and there's going to be dollars flowing to you, but I can also say to you, call us. For crying out loud, call us and tell us about what is going on, because if someone is forcing you to do this to work, and maybe your work is not essential and everything, then call us, please, and everything, because we'll try every way we possibly can to address every individual case. The only other thing I can say to you is Secretary Warner reported on our elections. I am very, very hopeful that as time goes by, we've still got 45 days until the election day, and I'm very hopeful that you're going to be able to come to the polls and vote, and let's hope and pray that things are much better than they are today. But I want to thank everybody for the questions, and we'll keep briefing you every day. Anyway, thank you so much.